Health Talk, brought to you by Rapides Regional Medical Center. You may have heard that the typical gallstone patient is fair, overweight, female, and 40. In reality, approximately 1 million new cases of gallstones are diagnosed each year, leading to gallbladder disease and surgery.
The main symptoms are pain following in the right upper part of the abdomen, which usually, but not necessarily, may follow a meal or especially fatty meal. Sometimes you can have associated nausea, vomiting. In cases of infection, they'll usually have pain also radiating to the back and maybe have a fever.
People with a poor gallbladder may discover their problem is worse after eating fatty foods.
Ultrasound can pick up the presence of gallstones and also can demonstrate whether somebody has an infection if the gallbladder wall looks thick or there's fluid around the gallbladder, both of which are signs of an infected gallbladder. Now, just because somebody has gallstones doesn't mean that they need to have the gallbladder taken out. Unless they have symptoms, I usually don't recommend taking them out.
Sometimes there are no stones, yet the gallbladder still causes problems.
What we call a dysfunctional gallbladder is one that's not contracting properly. And so if we do an ultrasound on those patients, they may not have stones. But following a meal, especially a fatty meal, they may have irregular contraction of the gallbladder, and so we order a test called a hydroscan. It tests the uptake of a tracer by the gallbladder and then excretion of that tracer during stimulation.
Should you need to have your gallbladder removed, oftentimes it can be done in a day surgery setting, and recovery takes about 3 weeks. To schedule an appointment with one of the surgeons at Rapides Surgical Specialists, call 769-3501.